put side by side the CDC maps of cancer death with the New England Journal of Medicine articles that are showing the antibiotic prescription behavior per state. And you can see a perfect state-by-state correlation with the more antibiotics prescribed per population, the more cancer death we have. And so in those two demonstrations, I've been able to show at the population level, antibiotic usage from your physician and pharmacy drives mood disorder and cancer death.
Crazy.
Collapse of the microbiome equals human disease. Now let's back up and ask how much antibiotic is being prescribed by our physicians. We're somewhere around in the United States a disgusting 7 million pounds of antibiotic per year prescribed.
Crazy.
Not prescriptions, but pounds. What that equals out to is 833 prescriptions of antibiotics for every 1,000 man, women, and children. And so we're somewhere around 83% by the numbers of the population, and there's probably some redundancy. It might be more closer to 40% of the population, where a lot of the population is getting 2 courses of antibiotics in a year. But suffice to say, 833 prescriptions for every 1,000 man, woman, child, that's a lot of antibiotic. And so that's equal to 7 million pounds. But in the United States, we use around 300 million pounds of Roundup. And so we are many logarithms greater in our antibiotic exposure through our farming industry and agriculture and our landscaping and streets, parks and rec services and the rest than we are at risk from our doctors. And so the real collapse of health is happening from Roundup spraying. We've proved this by looking at the concentrations of Roundup spraying and the water systems in which that Roundup ends up. The largest of these is the Mississippi River. The tributaries of the Mississippi River cover about 80% of the country, 80% of the Roundup spraying in the country, a footprint of maybe 60% of the country. And so with 80% of the Roundup that we spray in the whole country being absorbed into a single water system, it's going to be concentrated ultimately in the last 90 miles of the Mississippi River, which runs from Baton Rouge to New Orleans, Louisiana. And that happens to be called Cancer Alley. That's the highest rates of cancer in the entire developed world by an extreme amount. Interestingly, that deep south was never the epicenter of cancer death in our country up until 2007 hit. And so 1997 and before, our cancer death maps were northeast and northwest. And then suddenly in the 13 years between 1997 and 2004, we caused this decimating injury to the microbiome through the Midwest and concentrated a chemical that would wipe out the microbiome of the Deep South, and we would create the highest rates of cancer in the world. And of course, mood disorder is right there.
Crazy.
Interestingly, this is work now by Norm Shealy, who has run the largest pain clinic in the United States for over 30 years up in Wisconsin area. And his pain clinic realized early on in the late 70s and early 80s that an enormous amount of the patients that were presenting with pain had predisposing mood disorder. And so he ultimately became the biggest center for integrative medicine approaches to treating mood disorder, because he figured out that mood disorder happens shortly before chronic pain syndromes emerge. So major depression in the recurrent state will then turn into a chronic pain syndrome if not treated at its core. And so we can say in the population, if you have major depression, anxiety disorders, and everything else, and that becomes a recurrent theme where you're now in your second or third bout of major depression, the chance of you developing fibromyalgia, regional pain syndromes, like reflex sympathetic dystrophy or chronic regional pain syndrome disorders, those guys are all could have been captured earlier and prevented if we had recognized the relationship between the collapse of their microbiome, the emergence of mood disorder, and their march towards that chronic pain syndrome, and ultimately to the cancer that would follow.